Welcome, everyone. Thank you so much for joining this information session. I know you probably didn't get a lot of notice and anticipation, so we're really glad that you're joining us. This is an information session for the Sexual and Reproductive Health, Rights, and Justice Workplace Sexual Harassment Study. And we're doing this to tell you all a little bit about the project, explain what we're asking organizations to do in collaboration with the project, and answer any questions that you have. I'm going to go over some background about sexual harassment and the project, tell you the purpose of the study, tell you what the study involves and what we're asking organizations to do with regard to the study, and then answer any questions you have. And as a reminder, we are recording this information session so that it can be available for people who weren't able to make it, and we'll be posting it online. Why is this project important? Numerous recent studies examining various academic disciplines, government institutions, and private industries indicate that workplace sexual harassment is common in the United States. The National Academies of Science and Medicine's 2018 report on sexual harassment in science notes that studies on sexual harassment from the 1980s through today continue to show that sexual harassment of women is widespread in workplaces and that the rates of sexual harassment have not significantly decreased. Of course, we know that people of all genders can be sexually harassed. The study also found that experiencing sexual harassment has severe negative professional and personal effects. The study reports that people experiencing sexual harassment skip professional meetings and social situations, drop out of projects, and leave jobs to avoid harassment. Many do not formally report their harassment, often for fear of retaliation. While many other occupations and industries have also fielded surveys recently revealing that workplace sexual harassment is common, for example, economics, anthropology, medicine, and astronomy, to name a few, there has been no formal study to date assessing the prevalence or scope of workplace sexual harassment in the field of sexual and reproductive health, rights, and justice. It is likely that our field is not immune to a problem that affects all sectors, occupations, and industries in the United States. This study is a collaborative effort being led by a team of 3 researchers. They are me, Liza Fuentes at Guttmacher Institute, Lauren Maxwell of Emory University, and Ushma Upadhyay of Answer at UCSF. This study has 2 main objectives. We want to better understand the prevalence of workplace sexual harassment and assault in the sexual and reproductive health, rights, and justice workforce. And we want to assess how experiences of workplace sexual harassment in the sexual and reproductive health, rights, and justice workforce vary by gender, sexuality, race, ethnicity, and career stage. By doing this study, we will have a fuller evidence base that can ground conversations, allow us to brainstorm solutions, develop and share best practices, and recognize the complex factors that must be taken into account to ensure sexual and reproductive health, rights, and justice workplaces are safe in all regards, including regarding sexual harassment. This study can also bring attention to shifting needs of our field and in what ways we can and should make addressing sexual harassment a priority. Many small sexual and reproductive health, rights, and justice organizations may not have HR departments or have grown significantly in recent years in ways that challenge HR capacities. These factors, plus evolving cultural norms more broadly, as evidenced by the Me Too movement, means that our field has the opportunity and responsibility to reflect on and respond to the evolving needs in our sector so that we may have stronger systems to prevent and address sexual harassment. For this study, we will field an 8 to 10-minute web-based survey among employees of sexual and reproductive health, rights, and justice organizations. This survey will include closed-ended questions on demographics and professional characteristics of respondents and their experiences with sexual harassment and assault in the context of sexual and reproductive health, rights, and justice-related work and training positions. The survey does not collect information that could be used to identify individuals or organizations. The survey will provide an estimate of the prevalence of experiencing workplace sexual harassment and assault in the sexual and reproductive health, rights, and justice workforce as a whole. No organization names are collected, and there is one universal link to the study, meaning that the links are not specific to organizations or individuals. All the questions are optional, and any question in this survey can be skipped. The study protocol was approved by the Guttmacher Institute Institutional Review Board, which is the ethics committee that reviews the protocol for the protection of human research subjects. Survey participants will have the option to enter a raffle for a $50 gift card. One gift card will be raffled for every 100 respondents. The survey is administered using Qualtrics, a highly secure online data collection platform. It is widely recognized by institutional review boards as an appropriate tool for collecting health and social science-related survey data. While the survey is for individual people who work in the field of sexual and reproductive health, rights, and justice, the investigators, we, Ushma, Lauren, and I, are asking colleague organizations to help us ensure that their employees know about the study by informing staff that this study is happening and by sharing the survey link. By giving organizations the opportunity to be the ones to let their staff know about this project, it allows you the opportunity to have conversations with your staff about the fact that this survey is being fielded on your terms. Therefore, we are asking organizations to do two things. First, disseminate the survey to all staff. We are asking you to send an email to all staff with information about and a link to the survey. We will provide an email template to facilitate this communication that you can adapt as you wish. This does not need to be a formal endorsement of the study or a collaboration with the study, but simply notifying staff that this survey is happening in our field right now. To understand the survey response rate, we are also asking you to provide us with the total number of employees at your organization who were sent the email informing them of the survey. With this information, we can compare the total number of individuals who were invited to the total number who completed the survey. If this information is readily available, we are also asking you to provide us with the proportion of your staff who are women, men, and non-binary, the proportion of staff who identify in major race ethnicity categories, and the proportion of staff with formal supervisory duties. This will help us understand if response rates vary across these groups. We recognize that not all organizations maintain this information and that each organization may have unique needs and questions around these requests. And we are happy to discuss in more detail how we can make it possible for your organization to distribute the survey to staff regardless of the availability of this information. Who is involved in this project? We are in the process of reaching out to over 70 sexual and reproductive health, rights, and justice organizations to invite them to distribute the survey. So far, nearly 40 and counting have agreed to do so. Who else is involved in this project? We have formed an advisory committee of sexual and reproductive health, rights, and justice leaders to provide input, critiques, and feedback on every step of this study. The advisory committee includes members such as Gretchen Borchelt, Vice President of Reproductive Rights and Health at National Women's Law Center, Yamani Hernandez, Executive Director of the National Network of Abortion Funds, Dr. Anu Kumar, President and CEO of IPAS, Nikki Madsen, Executive Director of the Abortion Care Network, and Dr. Melissa Natavio, Director of Family Planning at the Keck School of Medicine at University of Southern California. We know that you may have questions about this study. Right now, we'll run quickly through a few common questions and then open up the floor to any other questions that you may have. How will you protect the confidentiality of respondents and organizations? We've taken several key steps. Just like all research, confidentiality of respondents is primary concern. As I mentioned, no organization or respondent names are being collected. The survey is totally anonymous and conducted with a universal link, meaning that the link is not specific to a person or an organization. Each research team member has signed a data agreement to never use data in any way that violates our institutional review board, ethics protocol, or our study protocol more broadly. And in particular, we are prohibited to attempt to identify any respondent in any way. This is standard for all research, but for this study, as per Guttmacher protocols, we've signed an additional agreement on top of our normal protocols. We've obtained a certificate of confidentiality from the National Institutes of Health. And as I mentioned, the survey is administered using Qualtrics, which is a highly secure online platform. It is, as I said, widely recognized by IRBs as appropriate tools for collecting health and social science-related survey data, and they encrypt the data in the place where they store it. We also will store and manage our data on a secure server that's on a secure server. If our organization chooses not to notify staff about the survey, will they still be able to take it? Yes, this is possible. As we said, the link is not specific to any organization. Anyone who has the link can click through the inclusion criteria, which are simply that a person works in the sector of sexual and reproductive health, rights, and justice. However, you notifying your staff about this opportunity allows organizations to take a leadership role on this issue and have a conversation with your staff about the fact that this study is happening in the field. This is a challenging topic. What if questions come up from staff about this issue? We hear you. We know how committed you and other leaders in our field are to preventing and addressing workplace sexual harassment and assault, and we also recognize that there may feel like there are many challenges to navigating and addressing these matters. To that end, we are providing organizations a resource that is a high-level overview of the key considerations for preventing and responding to sexual harassment at the organizational level. We will attach it in this presentation, and we can also send it to you via email at your request. While this document is a summary of several key actions and concepts, we hope that it serves as a point of reference to help sexual and reproductive health, rights, and justice leaders in doing the important work of addressing these issues and strengthening our workplaces and our movement. We also invite you to check out a new resource developed by Futures Without Violence that they created with partner organizations to provide workers across the U.S. with the strategies and tools they need to drive change and create the kind of workplaces where everyone has equal opportunity, access, and respect. And we can provide you the link to that as well. Thank you so much for your attention. We welcome your other questions, and you can always contact me, Liza Fuentes, at my email or my phone number here. And I know that you can also go to our co-investigators as well, Ushma Upadhyay and Lauren. So I'm going to open up the floor to questions, and Lauren and Ushma, the co-investigators, will also help and weigh in.
Hi, this is Doris. Can you talk a bit about the study timeline and what you're going to do with the results?
Sure, that's a great question. Right now, we are finalizing our survey. One of the really fantastic things about doing this research in collaboration with the feedback of our advisory committee and our colleagues is that we realized that we do need to make the study available in Spanish because organizations do have monolingual Spanish speakers, including Guttmacher. So we've, however, we did not do that in the pilot. So right now we're working on translating the survey and finalizing it and reaching out to organizations with the final information to distribute it. And we hope to be able to field the survey in the coming weeks. Right now we're shooting for mid-June. But we will keep people updated as shifting, things change in terms of programming and just make sure everything is on point. We expect to be analyzing these data over the summer, and the key thing that we want to do is submit it as an article in a peer-reviewed journal. We will also be doing a webinar to disseminate the results to our sexual and reproductive health, rights, and justice community. And for that webinar, anybody who works in the field can join to learn what the results are. So those are the two main things we're going to do with the results, but we're really open to suggestions about how best to leverage these results into productive, collaborative conversations to help strengthen our workplaces. If others have questions, you can jump in, and if not, that's also okay.
Hi, this is Susan. Is this survey just for people in the United States? And if not, are there other languages that this will be translated into other than Spanish?
That's a fantastic question. So right now for this,
two old fashions at the bar.
sorry.
I'm like, I don't know how to explain. Starting with the whole luggage thing.
Hi, I think someone may
Need to mute. And I'll just keep going. Thank you, Susan. That's a fantastic question. For this part of the study, meaning for this survey, the people who are eligible to take the survey are people, and the organizations that we're working with to distribute the survey are organizations that are incorporated or have an office in the United States, regardless of where their staff work. And the reason for that is just practical. It's because even though especially in our sector, we look to have workplaces that don't just follow the law, but are places to thrive. The fact of the matter is that when it comes to sexual harassment, the 1964 Civil Rights Act covers, organizations that are in the United States only. And so in order to have brought more generalizable conclusions about people's experiences vis-a-vis the law, organizations whose main headquarters are not in the United States and are subject to other laws are not included. Right now, we don't have plans to translate the survey to other languages simply because of the fact that since we're focusing on the United States, we don't anticipate that there will be many people who are monolingual in another language, although I recognize that it's possible.
So if I
I just wanted to
sorry.
I just wanted to reiterate that. So if a U.S. organization has staff in other countries, they will also be included.
Yeah, that's USHMA, our COI.
So they will be included, but if English isn't their first language, they just won't be able to participate.
If someone is unable to take a survey in English or Spanish, they will not be able to take this survey at this time. But if, we would love to have the resources to be able to translate it properly. And so if people let us know that they have staff for whom French or whatever another language is, that's really the language that they would be able to take it in, we do want that feedback, because then I can take it to our funders and my bosses to let them know that this is a huge limitation. So thank you.
Thank you.
Are there any other questions?
I'm gonna put our pieces on it. Okay, hi everyone, that's me, Liza. This is Ellie, our project manager.
And you can probably stop the video. Stop the screen sharing.
Perfect. Let me try to do that right now. All right.
See that? Is she still screen sharing? See that share?
Yeah.
No.
Oh, okay. We really thank everyone for attending. Like we said, we will post this online, so if you need to watch it again or you have a colleague who wasn't able to make it, we'll make it available to them. And you can always contact me or Ushma or Lauren or Ellie for more questions. And if we've already reached out to you and haven't been able to have a conversation with you, please let us know. We are always available for one-on-one conversations. We want to make sure everyone's questions are answered for this important study.
One thing I wanted to add is we're having an issue getting the attachment going, which was referenced by Liza earlier, which is a summary resource for organizations. And for those who are viewing this on recording, we want to encourage you we'll be reaching out proactively to organizations who are going to be distributing the survey with these resources, but we also invite you to reach out to let us know if you want to just see those materials, and we'll send them your way, and are excited to talk to you more about this project.
Ushma, did you have anything else you want to add?
No, I think it was clear. Thank you.
Yep. Thanks, everyone.
Thank you so
we'll be in
much.
touch. Bye.
Bye-bye. Take
Thank
care.
you, everyone.